Good evening, everybody. In today's class, we'll try to learn about appendicular skeleton. In previous class, we have discussed about skeletal system and we have started with axial skeleton. And in today's class, we'll discuss about appendicular skeletal system. See, in previous class, what we discussed, we know that skeletal system is divided mainly into axial skeleton and appendicular skeleton. Okay, the axial skeletal and appendicular skeletal system, both these system together, they will form 206 bones. And in axial skeleton, what we have bones of skull, we have bones of we have single bone, we call it hyoid bone, hyoid, hyoid bone, which is present in the neck, right? And we have auditory ossicles. In this we have the minute smallest bones of our body, which is present in the middle ear. In that, what we have malleus, we have stapes and incus. So in these three, stapes is the smallest bone. And in axial skeleton, we also have what we have vertebral column and thorax. So all these different bones of axial skeleton we have already discussed in previous class. In axial skeleton, we actually have 80 bones. In that, we have skull. In skull, we have cranial bones and facial bones. The skull bones contains cranial bones. In cranial bones, we have 8 cranial bones, and we have facial bones. In that, we have 14. 8 plus 14. Actually, here 22. In previous class, I told 20, but just to rectify that mistake. In skull, we have 22 bones. In that, 8 bones are from cranial bones and 14 are facial bones. Okay, and one is hyoid bone. And in auditory ossicles, we have 6. Okay, in both the ears, we have 3. In both the sides, malleus, stapes, and incus, in both the sides, we have total 6 bones. And in vertebral column, we have total 26 bones, and in thorax, we have 25. So in total, we have 80 bones in axial skeleton. This concept we have already discussed in yesterday's class. These all bones we have discussed. Now in today's class, we'll try to learn about the bones of appendicular skeletal system. Appendicular means, see, other than skull, neck bones, okay, other than skull, neck bones, ribs, and vertebral column, other than these bones, remaining all the bones, we have uh, upper girdle, shoulder girdle, bones of shoulder girdle, and upper limbs, bones of upper limbs. And here we have pelvic girdle and bones of lower limbs. All these bones are appendicular bones. We will try to discuss that bones. In appendicular skeletal system, total we have 126 bones. Okay, see, in appendicular, let me tell you very clearly. In appendicular skeleton, total how many bones we have? We have 126 bones. These are very important. Ek bone you have to remember. Okay, in appendicular skeleton, see, we have pectoral girdle, we call it pectoral girdle with upper limbs, and second one we have pelvic girdle with lower limbs. All these bones together, they will form 126 bones. Okay, so in appendicular skeleton, what we have? Pelvic girdle and upper limb bones, pectoral girdle and upper limb bones, pelvic girdle and lower limb bones. Okay, now you see, total number of bones are located here in the single slide. Dhyan se suno, this slide is very important. Just now what I told, appendicular skeletal system contains pectoral girdle and upper limb bones, pelvic girdle and lower limb bones. These total bones, they are total 126. See, in pectoral girdle, or it is also called shoulder girdle, in shoulder girdle we have 4 bones. One is we have scapula and the second one is clavicle. Clavicle and scapula contains pectoral girdle. And the upper limb bones, in upper limb bones we have humerus. This is humerus, the strongest bone of upper limb. We have radius ulna. We have carpals, metacarpals, and phalanges. See, in yesterday's class already I told, in carpals we have 8 plus 8 carpals. Here we have 8 and here we have 8. But in the feet we have tarsals, 7 plus 7. Okay, we have 14 tarsals, and metatarsals and phalanges are same. We will discuss those, all the bones, their morphology and their importance. Okay, in pectoral girdle we have humerus. In the upper limb we have humerus, radius, ulna, carpals, metacarpals, and phalanges. And in pelvic girdle we have hip joint or hip bone, pelvic bone, and we have lower limb bones. In lower limb bones we have femur, and here we have patella. Okay, tibia fibula. We have tarsals, metatarsals, and phalanges. Okay, so all these bones are they are comprised under appendicular skeletal system. Okay, so these are all different bones of appendicular skeleton. Now we will try to discuss about each and every bone, where they are located, what is their significance, okay, and their importance in orthopedic department. If these bones are fractured, what we have to do, and these bones will articulate with the different bones and they will form a joint, and we will try to learn the names of the joints and all other related concepts in appendicular skeleton system. Okay, so initially we will try to learn about uh, this one already we have discussed. In appendicular skeleton, mainly we have shoulder girdle which contains upper limbs, and we have pelvic girdle which contains lower limbs. And in shoulder girdle, in upper limbs and shoulder girdle we have clavicle and scapula, one clavicle and one scapula. And in upper limb we have humerus, radius, ulna, carpals, metacarpals, and phalanges. This one just now we have discussed. Okay, you can see here also in the image, this is uh, scapula, this is clavicle, humerus, radius, ulna, carpals, metacarpals, and phalanges. Okay, see, and now we will try to learn about clavicle. This is very very important, the bone, clavicle bone. Okay, this is called clavicle bone. Try to see in the image, this is clavicle bone or collar bone. It is also called collar bone. You can just touch and just below your neck at the right side and left side, both the sides, you can feel this bone, which will just, it will be extended outside. This is called clavicle bone or collar bone, and majority of cases in road traffic accidents this bone will be fractured. Both सारे cases में this bone will be fractured. And in fractures we have different types. In normal fracture conditions, what will happen is this bone will join itself, but in few cases surgeries are required. About that all conditions we'll discuss in next classes. See, about clavicle we have one important point. See, in yesterday's class I already told this is sternum, right? In yesterday's class I told this is sternum. In sternum, the head of sternum is called manubrium. In yesterday's class I told, and this is body of manubrium, body. And the below part is xiphoid process. This is xiphoid process which is connected with, it is connected with we have diaphragm muscles. Okay, this is the most stronger bone which is present in the anterior part of our body. This is called sternum. In sternum we have three main regions. The head of sternum is called manubrium, body, and tail. Okay, tail or xiphoid process. The head of manubrium on the both the sides, on head of the manubrium on the both sides, it will form one joint with clavicle. Clavicle will come and join here, and it will form sternoclavicular joint. The clavicle will come and join on the head of manubrium. This is manubrium. On the head of manubrium it will come and join here. You can see the image for better understanding. The red color one is collarbone or clavicle. It is coming and joining here, right? On the head of manubrium, on the head of sternum. This is manubrium. This is the head of sternum, and it is coming and joining here, and it is forming a very small joint. This joint, it is called sternoclavicular joint. It is called sternoclavicular joint. And another joint it is forming with scapula. See, there is another bone which is called scapula. This is scapula. This bone is called scapula or shoulder. It is also called shoulder blade. This scapula has two main regions that I'll try to show you. See here in the scapula, in the scapula we have acromion or acromial process here. Acromion we call it. Here it is there already. Acromion is the process of this scapula bone, and on the acromial process this clavicle is coming and it is joining on the acromion. And as this clavicle is joining on the acromial process of scapula, it is forming a joint here. That joint is called acromioclavicular joint. Simple. Joining of acromion and clavicle is called acromioclavicular joint. Simple. See, the clavicle is forming two joints. Here, the joint which is attached to the manubrium is manibuloclavicular joint, and here it is joining with the acromion and it is forming acromioclavicular joint. It is forming two joints. This is first joint and this is second joint. I think you all are following me. Yes, we have two joints. We have sternoclavicular joint here, sternoclavicular joint, and we have second one is acromioclavicular joint here, acromioclavicular joint, because it is going and joining on the acromion process of clavicle. Simple. Clavicle. And here one important point about clavicle bone. This is clavicle bone. What is the importance of clavicle bone? What is the importance of collarbone? Collarbone will attach the axial skeleton with the appendicular skeleton. Simple. Actually, in appendicular skeleton we have upper girdle, right? Or we have shoulder girdle. Shoulder girdle is the part of appendicular skeleton, and we have manubrium is the part of axial skeleton. So this clavicle is attaching the axial skeleton manubrium and it is attaching the appendicular skeleton humerus, okay, or it is attaching with the upper limb. Simple. It is the connection between axial skeleton and appendicular skeleton. Simple. What collarbone is doing? Collarbone is attaching axial skeleton and appendicular skeleton. I think you understood this. इससे ज़्यादा clavicular bone का कुछ ज़्यादा importance नहीं है. And one thing, if you are lifting anything with your upper limb, what will happen? The total force will be transferred from the appendicular skeleton to the axial skeleton, and that is because with the help of this collarbone or clavicle. That's why it is the link between appendicular skeleton and axial skeleton. Clear? I think you understood about this clavicle. You can see the clavicle structure को देख के समझ लेना. In laboratories you will be having when external comes, they will show you this bone. Identify this bone. This is a slightly S-shaped bone. It is a S-shaped bone. Just try to remember this bone, which is called clavicle. समझ गए सब लोग? Collarbone, clavicle bone. Understood everybody? And this collarbone is forming two joints. याद रख लेना. At one side it is going and attaching to the head of the sternum, which is called manubrium, and it is forming clavicular manubrium joint, and at another direction it is going and attaching to the scapula. Okay, chalo. So I think you understood this. And the clavicular bone, we have two ends. The one end which is going and attaching to the acromion. That's why this end of clavicle is called acromial end, and the other end which is going and attaching to the sternum, that's why it is called sternal end. Okay, this is lateral view and medial. Yes, sir, it is easy only. इसमें कुछ ज़्यादा, just try to identify the bone. Okay, and the next one is scapula. This is quite interesting bone. Okay, scapula is important. It is simply called as shoulder blade. I will try to show you the bone. Okay, this one. एक चीज you have to remember, whenever scapula comes in mind, it has three main regions or three main important clinical regions. Number one, it has glenoid cavity. Here it is having glenoid cavity. This glenoid cavity is very very important in attaching the head of humerus. Humerus के बारे में अभी बताता हूँ. I'll try to tell you the humerus bone. Humerus is going and attaching on the glenoid cavity of scapula, and this is first region. And second, it has acromial process. Already we discussed acromium. Acromium is the process on which the clavicle will come and it will attach here. Clavicle will come and attach here. That process which helps for the attachment of clavicle is acromium. Okay, acromion, acromion कुछ भी बोल सकते हैं. This is second part. And the third one is coracoid process. Here we have just adjacent to acromium we have coracoid process. This coracoid process is very important in attachment of muscles. These three regions are very important regions of this bone, which is scapula. Okay, so let me read this flat triangular shaped bone. It is a flat triangular shaped bone. Already it is very clearly seen here. Our images I'll try to show you. See this one, scapula, flat. It is very flat. This one, scapular bone, you can see it has three regions. One is glenoid fossa or glenoid process. It has acromium and it has coracoid process. On coracoid process, muscles are attached. On acromium, clavicle is attached. On glenoid fossa, here head of humerus is attached. This one, see, this bone is humerus. Here this one is humerus is attached at the glenoid fossa, glenoid process. Here glenoid process, this one. Clear? So this is about scapula. और क्या है, glenoid cavity we have already discussed. And sphenoid process projects beyond the lateral angle of the bone overhangs. ये सब नहीं. Acromion process already we know. Acroclavicular joint it forms, that we know. And coracoid process also we know. Here coracoid process is important in attachment of muscles, that already we have discussed. So these are important points about scapula. Okay, so we have discussed about scapula and we have also discussed about clavicle. Clavicle and scapula are the part of shoulder girdle. They are part of shoulder girdle. Okay, already we have discussed. Now shoulder girdle is finished. Now we will try to discuss about the upper arm bones of upper arm. In bones of upper arm, what we have? We have humerus, we have radius ulna, we have carpals, metacarpals, and phalanges. That we will discuss now. The first bone in the upper limb के upper arm. See, humerus, radius ulna, and all contains upper limb. Upper limb is total hand bones starting from the humerus, radius ulna, and all. Upper arm means just humerus. Okay, देखो यहाँ पे I'll try to show you this one. See, this till here we call it upper arm, and this one is mid arm, forearm. Okay, this is upper arm and this is forearm. Clear? This is humerus is upper arm and this is forearm. Okay, radius ulna is present in forearm. Okay, I think you understood this point. And upper limb means total. This total is upper limb. This total humerus, radius ulna, this is all is upper limb. Upper limb is the part of appendicular skeleton. Okay, anyways, अब देखो. So we are discussing about humerus, right? अभी we are discussing about humerus. So humerus is the strongest bone of upper limb. It is strongest bone of upper limb. And in the lower limb we have femur. Okay, we will discuss that also. So this is the bone of upper arm. And see, I just told you the head mainly articulates at the glenoid cavity of the scapula. This point already we discussed. And see, we have certain projections of this humerus. We have greater and lesser tubercles. Here we have greater and lesser tubercles, which are important in attachment of certain tendons, muscles, and all. We have basipital grooves also here. Basipital grooves, yes, sir. These are important in attachment of tendons and some muscles. Okay, and the distal part of bone has two surfaces. Here you can see these are lateral, epicondyle. We have yes, sub regions. It is not necessary for us to remember. Yes, sub, it is not required, but just yaad rakh lo. Humerus is this strong bone of upper arm, I mean upper limb, and it is present in upper arm. And the head of this humerus is attached to the glenoid cavity of scapula. And the lower side of the humerus is attached to radius and ulna. We'll try to discuss that. Okay, so this is humerus. And next is radius and ulna. Okay, radius and ulna, these both the bones are part of forearm, they are the part of forearm. The ulna is longer than radius, याद रख लो. Radius ulna we call, always radius is small and ulna is long. Radius ulna याद रख लेना. Okay. And here these forearm bones, radius and ulna, on the distal side it is attached to the wrist joint. Here it is forming wrist joint, and on the upper side it is forming a elbow joint. This is called elbow joint. It is attaching with the humerus. Okay, it is attaching with the humerus and it is forming elbow joint. Actually this radius and ulna is forming two joints. On the upper side it is forming elbow joint. You can see this one is elbow joint. Actually this is a have you heard about osteoarthritis? In osteoarthritis this joint is destroyed. Actually here, due to this destruction, it will cause a lot of pain. Anyways, about the disorders we'll discuss later. So this joint is elbow joint, or detail में दिखाता हूँ. See, this is elbow joint. Elbow joint is formed with the connection of radius, ulna and humerus. Radius, ulna and humerus is forming a joint which is elbow joint. Okay, so radius and ulna is forming elbow joint with the humerus, and at the distal side it is forming a wrist joint with we have here carpals. Okay, we have carpals. It is combined with the carpals. Okay, so with the carpals it is combining, it is joining, and it is forming elbow joint. It is forming wrist joint. याद रख लेना. Okay, so here the space or the joint between this radius and ulna, you can see interosseous membrane. There is a small membrane here. Actually it is present between these two bones. Yes, all these things are not important for us. Just remember the names of these bones, where they are located and what is their significance. Okay, elbow joint हो गया. Now carpals are very very important. कितने carpals है अपने को? We have 8 plus 8 carpals. Total how many bones we have in carpals? We have 16 bones. And tarsals क्या होते हैं? Tarsals are same like carpals, but they are located in the lower limb, in the feet, the bones of our feet. They are tarsals. And in tarsals we have 7 plus 7. याद रख लेना. हाथ के अंदर carpals we have 8 plus 8. 8 means in one hand we have 8 bones, and in other hand we have 8 bones. 16, we have 16 carpals. And tarsals how many we have? We have 14 tarsals. ये चीज याद रख लेना. Now you can just remember the names of these carpals. Total 8 plus 8, this 16, matlab we have 8 carpals. In 8 carpals you can remember the names of these 8. We have scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, and we have trapezium. All these are bones. These are different bones of carpals. Okay, you can see these bones of carpal. These carpal bones are attaching to the radius and ulna, and it is forming a wrist joint here. Okay, wrist joint. Okay, this point we have already seen. Yes, the bones of wrist you can see. Carpals, we have 8 carpals. Okay, 8 plus 8. And here you can see we have 2 rows actually. We have proximal row and distal row. Okay, 2 rows we have. Proximal means towards the body, and distal means towards the outwards to the body. ऐसा याद रख लो. So in proximal, just now we have skin. We have scaphoid, we have lunate, we have triquetral, okay, and pisiform. These are proximal row bones of carpals. And distal row also we have trapezium, trapezoid, capitate and hamate. ये सब names याद रखने की जरूरत नहीं है, but you try to remember. In carpals we have 8 bones. Okay, and next is we have metacarpals. These are metacarpals. We have 5 metacarpals. 1, 2, 3, 4, 5. Okay, we have 5 metacarpals. And see, we have phalanges. Phalanges are finger bones. See, always remember we have 14 phalanges. We have 5 fingers, but in our thumb, अपने thumb के अंदर, अंगूठा के अंदर, we have only 2 phalanges, and remaining 4 fingers we have 3 each. So 3 4s are 12. 12 plus 2, 14. We have 14 phalanges for both feet and also for wrist, for arm also. In hand we have 14 phalanges, and in feet also we have 14 phalanges. And these phalanges, these 3 phalanges on finger, the phalanges which is present towards the metacarpal के साइड जो होता है उसको बोलते हैं proximal phalanges. And in middle we have middle phalange, and the corner one, the final one, is called distal phalange. Distal means it is away from the body, proximal means it is towards the body. ऐसा याद रख लो. In each finger we have 3 phalanges each. So proximal phalange, middle phalange, and distal phalange. Okay, so 5 fingers, 14 phalanges. Okay, and these are metacarpals, carpals, metacarpals, and phalanges. Clear? So this completes our bones of the upper arm. So this you can see, these are wrist bones, wrist bones. Now we will go with the lower part of appendicular skeleton. In lower part we have pelvic girdle and lower limb. In lower limb we have femur, patella, tibia, fibula. We have tarsals, blue color one, tarsals, metatarsals, and phalanx. In tarsals I told 7 plus 7. And carpals we have 8 plus 8. याद रख लेना, हाथ के अंदर we have 8 plus 8 carpals. They are carpals and these are tarsals. Okay, yes. So the bones of pelvic girdle, we have 2 innominate bones, sacrum, these are bones of the pelvic girdle, and we have 1 femur, tibia, fibula, 7 tarsals, metatarsals, 14 phalanges, and patella. Patella is separate bone. In hand we don't have patella, we have joint of this, what this joint, this is for elbow joint, and here we have patella. Okay, now about pelvic girdle, and this I'll try to discuss the difference between pelvic girdle in female and pelvic girdle in male. This is little bit interesting and important. See, the pelvic girdle in female is quite different than pelvic girdle in males. See, we have in the general structure, if you see, these are certain points. The general structure of pelvic girdle is light and thin in females, and it is heavy and thick in males. Because in males we have testosterone, we have so many other androgens and other physiological conditions which will harden bones and which will improve the more concentration of hemoglobin and blood. In previous class I already told. Due to the presence of testosterone in males, the bone size and bone structure, bone density is quite higher and heavy and thick when compared with females. General structure of pelvic girdle in females is light and thin, whereas in males it is thick. Simple. We have false greater pelvis. Okay, you can see the false. These are called false greater pelvis. These regions. If you see the false greater pelvis of females, it is shallow, whereas in males it is very deep. This is shallow means that it is quite areatic, it is having more area, whereas in males it is less, it is deep. यहाँ पे थोड़ा depth में रहता है, it is very shallow. Okay, and pelvic brim, we call pelvic brim this one, or the area between this pelvic girdle, it is wide, whereas in males it is narrow. In females it is wide, and in males it is narrow. Why? Because here in females we have uterus, we have vagina and all. Due to the presence of female reproductive organs, this pelvic girdle has more space than males. And acetabulum, you can see acetabulum here. The acetabulum is the cavity of it is a cavity which joins the head of femur. Femur bone will come and enter, I mean it will join with this acetabulum. It is important. See, acetabulum is small and it faces anteriorly, whereas in males it is large and it faces laterally. It is facing laterally and it is bigger. Okay, remember like that. And obturator foramen is oval and round. Here in females it is oval, and here it is round. And here you see the pubic arch. This is important. Pubic arch, the angle between these two bones, this is called pubic arch. The angle is more than 90 degrees, you can see. But in males you can see it is less than 90 degrees. It is less than 90 degrees, this pubic arch. And iliac crest, ilium, all these are, you can see, these are important differences in pelvic girdle of females and males. Okay, yes sir, in exam you will not get all this, just for understanding purpose you should know. Okay, about this pelvis and all, we already know we have sacrum, symphysis pubis, and ये सब already अपने को पता है. And here see, males and females already we discussed. See, due to the anatomical feature of this pelvic girdle, males and females are named as ultra female and females, just because of the more space or more cavity in this pelvic girdle. If such type of females who are having this type of pelvic girdle are considered as ultra females, and normal one is female normal. And in males also you can find ultra wide angle बोलते हैं ना, ultra wide angle camera, for more space, which covers the more space. For them we call all this. Okay, ये सब just for morphological differences they are naming like that. Okay, just remember ये चीज़ याद रख लो बस. Females में you just remember, because in females we have reproductive organs. That's why female pelvic girdle is quite larger and it's having more spacious than males. Now, yes, femur joint. Femur joint is the strongest and longest of all the bones in our body. And just now I told the head of this femur is going and attaching to the acetabulum of pelvic girdle. Okay, and it is forming a hip joint. It is called hip joint. Here it is causing a hip joint. Okay, it is the long bone and it attaches tendons, muscles, all these things. We already discussed, same like humerus only. Okay, and next we have tibia and fibula. Okay, tibia is one bone. Just you can see this is femur and this is tibia fibula. I'll just try to show you. Tibia is this is, you can see the bone of this tibia. If you want you can read this. I'll try to send you this PPT, you can read afterwards. And this is fibula. Okay, tibia and fibula. This is knee joint. Here we have patella. This is patella. Okay, we have tarsals, metatarsals, and phalanges. Okay. So now patella, which is also called kneecap. Okay, it is just present between femur and we have tibia fibula. Okay, between tibia fibula and femur. And now, yes, as we discussed, same like carpals in upper arm, we have tarsals in lower arm. Okay, these are all tarsals. Okay, and these are all metatarsals, and these are all bones of the fingers, which are called phalanges. Okay, phalanges are common. We have 12 phalanges. We have 5 metacarpals, and here in the lower limb we have 7 plus 7 tarsals. ये चीज याद रख लेना. Okay. Each name also is there. That all, if you want to remember, you can remember all the names. Like we have talus, navicular bone, cuboid bone, calcaneus bone. Okay, talus, calcaneus, cuboid, lateral cuneiform. We have intermediate cuneiform. We have medial cuneiform. All these are different bones of tarsals. Okay, we have metatarsals, 5 metatarsals and 14 phalanges, same like wrist and upper arm. Okay, so these are total. We have 126 bones of appendicular skeleton. In appendicular skeleton we have 26 bones, and in axial skeleton we have total how many? In axial skeleton we have 80 bones, and total we have 206 bones. That's it for today. We will continue joints and types of joints and disorders of joints in next class. Okay, until then, stay tuned. Keep watching our videos. If you like or if you learned something from our video, please don't forget to subscribe and share it with your friends. Thank you.